Ideal characteristics of a space maintainer include that they're simple in design, durable, strong, stable, and ideally long-lasting or good longevity, and very important that they're passive. So they, when they're to be fabricated, that they're not exerting any excessive pressures on the adjacent teeth and actually not causing any undesirable tooth movement. Ideally, they should be cleansable and not increasing risk for caries development or any soft tissue irritation or potential pathologies. So with all that said, when should one consider using a space maintainer, or what might be clinical situations or examples of that we are to plan to use? Well, there's some questions or things that we're to consider when treatment planning. To start with, which tooth have we lost? Is it a posterior tooth or is it an anterior tooth? How about the period of time that's been elapsed since tooth loss? Are we planning the space maintainer as we're to still do the extraction, or has the patient presented to our office already without that tooth? And if the case, do we know how long the tooth has been missing for? Are we looking at days, perhaps weeks, maybe months, or years? All this definitely carries relevance. Occlusion. Are there any, for example, cuspal interferences or occlusal interferences that may hinder one in designing a space maintainer? How about space analysis? Does the patient already lack room in the area where the space maintainer would be placed? And if so, do we see future orthodontic needs, and maybe they're a candidate more so for space regaining and not so much space management? How about the successor tooth? Can we see it? Is it there? If so, how much bone is covering it? And can we make any predictions as to when we expect it to erupt? And we'll get into some points with that shortly as well. Very important, patient's health and cooperation. Do we expect the child to be cooperative, for example, for the impression taking and the band fitting, that being the first appointment, and then the fitting of the appliance itself and cementation? And perhaps most important, oral hygiene. If we have any concerns about the patient's existing oral hygiene practices and we don't foresee improvement, one should be cautious when using a space maintainer, only because, as in any time an appliance is to be added in one's mouth, we do know that oral hygiene will become by default that much more challenging.